for inviting me to this meeting here. I always know that my mom attends these kinds of meeting, but I was not a participant. But I know that she'll be attending. But it's very happy that now I am attending and I'm also trying to help out. I have prepared a small presentation on this topic on difficulties in swallowing, and I have named the topic as accepting dysphagia. The reason I did that is because before I introduce myself as Sahana, speech language pathologist, I also know that I'm a daughter of an individual who is suffering from Sjogren syndrome. So our whole family is aware of the issues, difficulties leading to swallowing and eating. So, but when it comes to dysphagia and especially in Sjogren's syndrome, it's not about fighting against it, but rather than accepting it. But accepting doesn't mean that you're just leaving it as it is, but then you're trying to manage it, and how well you manage it is that's what is important. So I want the newer members of this family to understand that dysphagia is going to continue and is going to be a part of Sjogren syndrome, like how many other individuals like my mom is suffering from. But there are ways that we can manage it, and it'll only come when we are trying to accept it. So that's my topic. So let me just quickly go into the topic, but before I do so, I request all the members here to be an active participant during my presentation. I would be asking few questions, not be difficult. I would love responses from your side so that I'll have an understanding on what you all thinking at that moment. And also, as Kirtida ma'am said, if you have any difficulties following this, since I'd be speaking in English, please feel free to stop me in between and then go forward, because it's going to be information packed. There's going to be a lot of information regarding our swallowing anatomy. It is not going to be easy at all. It is never going to be easy. So please feel free to stop me in between. Even if you have any doubts, I am very happy to come back and explain it to you. Okay. So, what is dysphagia? People ask, no, what is dysphagia? Dysphagia is a new term. So, dysphagia is difficulty in swallowing. But what is swallowing again? But swallowing is nothing but eating. But when I say it very simply, there are a lot of process that involves in this. So, let us keep looking at this. So, these are the signs and symptoms are usually experienced by people who are having difficulties in swallowing and difficulties in eating. You may not have all these problems because this is an extremely big, broad spectrum. This is also experienced by the people who are having neurological conditions, by stroke or any cancer patients. So this is a huge margin, but I'm sure that you will like at least experience one or two symptoms from here. So let us look at each and every symptoms. So the very first one is food or liquid spillage from mouth, lips or nose. So usually what will happen is food coming out from your lips like this or through your nose. The second one is coughing before, during and or after swallowing. Whenever you eat, it is always accompanied by a cough. You eat, you chew, there's a cough. You swallow, there is a cough. So usually a cough is always accompanied during your swallowing. Third thing is persistent throat clearing during meals. Throat clearing is this. You constantly doing is a throat clearing. You don't know why you are doing it, but you always have the feeling to do this. So persistently doing this is not a good sign. So persistent throat clearing, especially during meals, is also a sign and symptom of dysphagia. Fourth is inability to clear food from your mouth. Now, food is sticking. Unless Sjogren's patients take in a sip of water or they dilute it, they are unable to clear the food from their mouth. Next is fourth one, food sticking to the throat. The same thing, you feel it over here. Food is sticking somewhere over here. So you need some kind of lubrication. So you take in water. Otherwise, the food is not moving on its own. But before Sjogren's or before this was identified, this was never a problem. But however, now you feel that, inability to clear your food from your mouth and from your throat. And then next is food residuals remain on the tongue and cheek. You often find extra bits and pieces of your food that is always here. It's not one sweep full go. It's always remaining somewhere in your food, mouth, or the cavities of your cheeks. The next is shortness of breath during chewing or swallowing. Usually, chewing and swallowing doesn't really involve much of your respiratory system. However, if you're having difficulties managing your respiratory system and your buccal cavities, then there is an issue here. Then the fourth one is difficulty or excessive chewing. I'm sorry of the numbers. Difficulties on excessive chewing. So usually we chew, take for an example, a banana. You might chew it for 5 times, maximum 10 times, but you chew the one piece of banana continuously for 20, 30 times. You keep on chewing it, but you're unable to swallow it. There is something that is restricting to swallow it. This is often found in hard candies, the chewable hard candies, that you can chew it, but something or somehow it is restricting you to swallow it. Usually because the tongue and then weakness which is following it. And then the next one is pain and discomfort of swallowing. This is pretty self-explanatory, as you know. There is some kind of usual pain, usually focused on the throat area, not much on the tongue during swallowing. And then the next is effort to swallow. You cannot just swallow it like this anymore. You have to do this to swallow. Swallow is never easy. You might not really feel that, but if you subconsciously think about it, you're not swallowing like this anymore. Easy peasy. It's always an extra effort that you push in. Maybe an extra effort in your throat, maybe an extra effort in your cheeks, maybe extra effort in your tongue, but always an extra effort during swallowing. Next is foreign body sensation. You've swallowed the food, but some things it feels like something food is still remaining in your chest. There, so you feel the need to take in more water, or you feel that you need to put in next piece of food so that you feel that this will clear it out. The next one is vocal quality. Your voice all of a sudden changes when you're eating, and after eating your voice changes. Your voice sounds very different. You don't sound like this, but suddenly your voice is now different, and that is a very important sign and symptom for dysphagia. Then the last is avoidance of food. You don't feel like eating, poor appetite, you don't want food, and all of a sudden you're just experiencing weight loss. So these are the broad spectrum of signs and symptoms of dysphagia that is experienced by many people. People under individuals of Sjogren syndrome, individuals who are suffering in cancer, individuals of stroke, or any other neurological implication that the patient might have gone through. And as I said in the beginning, even though you may not experience each and every point, but I'm sure you would know at least 1 or 2 points from this. So I understand my troubles. I understand what is happening to me, but why it is happening to me? That's the $1,000,000 question, right? I understand I'm having troubles. I understand my food is sticking into my mouth. That's what majorly happens with Sjogren's patient. Without sip of water, I'm not able to eat sandwich. Without a sip of water, I'm not able to eat bread, biscuits, chips. So I understand why all this is happening, but why do I have it? So to that, I have some videos. I would like to share those videos to you.
नॉर्मल में क्या होता है? नॉर्मल सैलून में नीचे चला जाता है।
Hello, may I request everyone to keep their mics on mute?
So this is the side profile of our face. As you can see, this is our tongue. Our tongue is a huge muscle actually. From all the way from bottom of our jaw till all the way till the top. Our tongue is pretty huge here. So this is our tongue, and this space is the cavity. This is that space. This tiny space is this cavity here. Okay. And now focus on this one. What is this? This is a passage to our nose. So while swallowing, if you see, this passage will close because food doesn't want to come out through our nose. Food is going, and then the person is chewing. Nicely, he's chewing. And then he's breaking it down into smaller bits. See, it has become smaller. So you've broken it down into smaller bits. And then now you've made it into a bolus. Bolus is like a ball shape. You made it into a ball shape. See, now let's check whether what is happening in our body. Slowly, we will try zooming in now. See, first what is closing? This passage. Because food doesn't want to come out through your nose when you're eating. So this passage closes. That is from a nose. This passage is in closing. Next, very important passage. Yes, this passage right here, this passage closure is happening. Why? Because over here, if you see, this is the windpipe. I'm speaking the windpipe. When you speak, you put your hands on your throat. You'll feel vibrations. You'll feel vibrations. Why that vibrations are coming? It's because the windpipe is here. The first pipe in your throat is the windpipe. The second pipe in your throat is the food pipe. So your windpipe has to close. Otherwise, what will happen? You'll choke. You'll have cough. So the windpipe is closing here. This is the closure. The lid is called the epiglottis. The epiglottis lid is closing. And check whether how tiny the food pipe is. In reality, food pipe is very small. Food pipe is not big. It is very, very small. Food pipe is very small. It is close to our neck bone. Neck ka bone, it is very close to our neck bone. So if you see when comparatively, windpipe is big. Food pipe is very small. So we have to be really careful while eating. Because if this lid is not working, if this lid is open, food will easily come to our windpipe and we will start choking, and then it will lead into further complication. So this is where swallowing happens. Windpipe always close, food goes to food pipe. Okay? And now it is slowly going, and that is all. Now everything is relaxing. Everything is now coming back to its original position. Everything is relaxed because food has gone. However, not always we all have the good same thing that is happening. People will have difficulties. And one such difficulties is this, my another patient. What he is having, the problem is the food is not going into the food pipe. It's actually coming into the windpipe. But luckily, since the lid for the windpipe is closed, so it is not going inside the windpipe, but you can still see that the patient is having difficulties swallowing it because it is not directly going into his windpipe. And these are all the symptoms you would also experience. It's similar to Sjogren. So this is the foot pipe. Foot pipe, as I told you, it's very small in size. It's not really big. It is small. Windpipe is what big is big. So while we are swallowing our food, we have to be extremely careful. Why? Because everything depends upon this lid. Windpipe ka lid. This windpipe ka lid is not working, then we are at great danger. But since we are not a people with muscular skeletal issues, we are now saved. So this is how the food happens. The windpipe is closed and then the food is going into the food pipe. So from the start to finish, if you see, we chew our food and then we make a bolus. Bolus is nothing but breaking down, putting it to a ball. Then our tongue is pushing like this, back. And then when the tongue is pushing, your nose is closing. Otherwise, it will come out through your nose. Your nose is closing. Then what happens? Your windpipe is closing here. And then the food is coming down. The bolus is pushed further back. Food pipe is opening. And then in esophagus, the peristalsis movement, the wave-like motion, it begins. So essentially, there are 4 steps of eating or swallowing. The first is oral preparatory phase. Oral preparatory phase is where you chew, you make a bolus. That is the first phase. The second phase is the nose is closing, Windpipe is closing, food is going in. That's the second phase. The third phase is food is entering to the throat. And the fourth phase is the food is going into your esophagus. So these are the 4 phases of eating. This is important because we are going to discuss regarding this. So 4 phases: your oral phase, your oral preparatory phase, your throat phase, and then the esophageal phase where it is going directly to your stomach. This is really important. So again, since it's important, I'm putting it back. The oral phase is happening here in your mouth. You're making a bolus. Second is this. Your nose closes. This is the second phase. The food is going in. The third phase is where food is going into your throat. The fourth phase is what? Food is going to your esophagus. 4 phases. Again, coming back to the same thing. This is an in-practice session, so I would like to have receive some answers. If you don't have teeth, what will happen? You cannot chew. So this will go. Now, if your tongue is not moving properly, what will happen? You cannot make a bolus. If there is no lubrication, what will happen? The tongue cannot push. This will also go. Ho gaya. If the nose muscle is not closing, back of your nose, not here, back of your nose, what nose muscle is not closing, what will happen? Food will come through your nose. That also ho gaya. Next, windpipe is not closing. What will happen? You will choke. You will be coughing. Next, if the food is not pushed further back and it is only staying here, then what will happen? Food is only coming here. It's not going anywhere. Staying. Uncomfortable situation. Worst case scenario, again fall into the windpipe. If the food pipe is not opening, food pipe also has to open. Food pipe is not opening, where the food will go? Accumulated food. Again fall into the windpipe because that is what next to it. Where is it? If the peristalsis movement in esophagus, the movement is like this. But the moment there is no movement in the peristalsis, what will happen? You'll feel that food is here. You'll feel that food is stuck over here. So this is what from start to finish, each and everything in your body is important because swallowing is a complex mechanism. All other musculature, for example, movement of your hand, you only want one muscle. I mean, there are 2 muscles here, but one group of muscle. I want to move my leg. Imagine this is my knee, only this. But with respect to swallowing, there are 20 different kinds of muscles are acting. So it's just not one muscle or 2 muscle, it is 20 different kinds of muscles. So it is extremely important. That is why I have put it once again. So again, in first phase, if there is no teeth, I will have disturbance in mastication. That is point number 1. If there is no saliva, what will happen? I'll have disturbance in my lubrication. If my tongue is not working properly, then it cannot make a bolus. My first phase is already gone because these are all the deficit. Now the pushing phase. If my tongue is not pushing backwards, the food will only stick here. If I have hole in my roof of my mouth, hole here, anywhere, food will come through my nose. If I have ulcers, what will happen? I cannot again swallow. Lesions in the buccal cavity, floor of the mouth, if I have ulcers, what will happen? I cannot swallow efficiently. Next is throat phase. If I have some mass lesions that is coming, again, I cannot swallow. The epiglottis, the lid for windpipe, it is not working. Again, swallowing difficulties because food will fall into your windpipe. That is the most dangerous one. You don't want food to come into your windpipe because you cannot take it out. You cannot cough it out because once gone is gone. So what will go? It will go sit in your areola. Then you'll have breathing difficulties. Then the breathing difficulties will improve and improve. Then the next thing is when the esophagus is not opening, it will still, where it will still fall into your windpipe because that's the closest one. Now the esophageal. What if the esophagus is not moving the food like this? It has to move through your throat to your stomach, no? What will happen when that is not working properly? Usually people with Sjogren's will have difficulties with respect to esophageal disorders because your own antibodies are affecting your own organs and esophagus is one of that organ. The motility disorders is also found in people with Sjogren's next is disorder. Reflex. Lot of acid coming out of your from your stomach. Why acid is coming out of my stomach? Because I'm eating slowly. Why I am eating slowly? Because I have no saliva. So I'm eating slowly. But food pipe is open. Food pipe is ready. So, but where is food pipe is connected to? Food pipe is connected to your stomach. So what will happen? Acid from the stomach will start to raise up. It will come through your food pipe and it will affect your whole throat mechanism because the food pipe is waiting for the food. But the food is coming very slowly. In the meantime, what will happen? The acids which are in the stomach will slowly raise up. It will come all the way up. Then you'll have issues all over your throat. So this is a study. In the study, they say that oral phase, that is in the mouth, is what difficulties in oral phase is what people in Sjogren's syndrome experience the most. That is the topmost. Next comes the esophageal phase. They don't feel difficulties here. They feel two difficulties, one over here mainly. That's what they say that. We will see why it is happening now. In oral phase, this is a study done in the US. There were 3,000 participants. 3,000 participants, they said that in the order, this is the order, 97 participants reported that they have dry mouth. Then 90% participants reported they have dysphagia. Dysphagia meaning that they cannot keep talking. They cannot continue talking. They need a sip of water now and then. They have difficulties talking for a long time continuously. Then they have oral ulcers. Then they say dental cavities. Caries is cavities, correct term. Then parotid swelling. Then they said oral candidiase. Candidiase is fungal infection. And then gland infection. So the topmost everyone reported in the 3,000 participant study is dry mouth. And then the least one everyone said was the gland infection. I hope you all can also agree that dry mouth is the most everyone experience. And then the gland is probably some one or two from here. So what happens to the next phase? Difficulty initiating swallow, slow eating, heartburn. You feel like sometimes your heartburn is there, belching, burping. But it is not normal burping sound. The burping is always coming up with very hot or very acidic burping, very painful burping. And then water brash, so regurgitation. This will happen very rarely to people who are having very acid reflux. You'll feel that water is coming. It's not vomit. It is not normal burping. Water will come, but that water is very bitter. It's very acidic. That is water brash. And feeling of food in the chest. You feel that food is still stuck somewhere in your chest. This is what people have reported in the study. So now I said that oral phase is the most greatest, is the what people more experience. Now what can I do? Everyone is experiencing difficulties in oral phase. This is the hard truth that I'm going to put down here. We cannot therapeutically, exercisively, you cannot do anything to improve your oral phase difficulties because it is a part of Sjogren's disorder. I know this can be a hard pill to swallow, but this is the harsh truth. The difficulties that all these people are experiencing, right? The dry mouth, oral ulcers, dental cavities, all this phase is also important. So what can I do for that with respect to therapy? Actually, there is none other than taking good oral cavity and maintaining the oral health. So I spoke to my dentist friend who is also working with me in my hospital. And she was telling about people who are having dry mouth and what all they need. They need a lot of calcium. The first and foremost, she said, is calcium. Because teeth, they're going to have an erosion of teeth because people are experiencing dry swallow. There is no saliva in your mouth. So what she said that you all need calcium. And how do I need calcium is through dairy products. And why I need calcium? I need that calcium for my teeth. Then I need phosphorus. This is in order of requirement. Calcium is the topmost and then the last. So the order of requirement for the teeth again is phosphorus. I need phosphorus for my enamel, not for my teeth, for my enamel, because enamel is only preventing me from my cavities. So where can I get that? From meats and nut. Next, I need vitamin D. And vitamin D is for absorption of calcium and phosphorus. You are taking calcium and phosphorus through medication. It's not going to help you if it is not absorbed in your body. You also need to take vitamin D. So vitamin D is for the absorption and also for the immune system. Next is fluoride from the acid attacks. As I said, since we are swallowing, as my mom, everyone, people experiencing Sjogren's, you all eat slowly. You don't eat fast. Am I right? So you all eat slowly. So what will happen if you're eating slowly? Your food pipe is open because it is going to receive food. So what is happening? Acid from your mouth, from your stomach is traveling upwards, and it can cause all the cavities, all the problems in your throat, in your mouth, and also in your teeth. So you need fluoride to prevent from your acid attacks, and you'll get fluoride usually from the paste. And vitamin D for the gum health, and protein for the overall body health and salivary glands. So there is not going to be exercises or any magic medication that is going to help you. I'm very sorry, but this is what we have to follow. So there are treatment which your primary physician might give you, such as saliva substitute, oral comfort agents, fluoride and chlorhexidine rinse, and remineralizing agents. People who've been living with Sjogren syndromes for 20 years, like my mom, will know that none of these give you the optimum result. There is nothing which from here will say that this is the best. There is no something called this is the best. You have to try it out what works best for you and then keep following out, but this will be recommended through your primary physician. So as I said, everything is a chain reaction in Sjogren syndrome, and that is what is important. Because there is an absence of saliva here, you are getting cavity and fungal infection because saliva is not there to protect you. Because you're having cavity and fungal infection, your enamel is wearing. Because your enamel is wearing, you're having erosion. Your teeth are turning black, your teeth are turning brown. Why is that happening? It's because your enamel is going away. Why? So what happens when enamel is going away? I cannot clear my food from my mouth. I cannot effectively clear the food from my mouth. Earlier, somebody asked, I'm biting my cheek. Why it is happening? Because you're not able to clear food from your mouth effectively. You think that your food is still there, so you bite your cheek. So it is not the problem of the cheek, actually. It's the problem of your teeth and the problem of the absence of saliva. That is why you keep biting to your cheek, because you feel that food is still stuck somewhere. So you try to swallow it again and again. And by mistakenly, you bite your cheek. Because of that is happening, where the food is going very slowly, there is a prolonged time. Slowly it is going. Swallow is supposed to happen like this, like this. But you saw the other patient was swallowing very slowly, right? It was coming here, it was coming, then it was going down. So you are eating very slowly. Because you're eating very slowly, you're having acid exposure. Because the acid is constantly coming up, what is happening? The food pipe is not moving. Aperistalsis, the wave-like motion is not happening. So this is a chain reaction starting from the absence of saliva till the food pipe. So now what can I do for that? Well, we can tackle the oral phase, because as I said here, regarding the oral phase, there is no exercises, no magic medication. So before you eat anything, I know everybody who are experiencing Sjogren's will be following this. I don't have to tell this, but as a way to introduction and also for the newer members, I'm saying this. So before you eat, wet your mouth, eat soft foods. But people can say that, oh, I love my chips, I love sandwich, I love eating breads and butter. What can I do now? It is very dry. Biscuits, I love biscuits. What can I do now? Go ahead, take your biscuits, eat your biscuits, you chew your biscuits. But again, what you have to do when you swallow, you have to take a sip of water, make it into a bolus, then you swallow. If you want to eat something, go ahead, eat. Nobody's restricting you, but you would face the difficulties. It is guaranteed. So what you do to minimize that? You will take a sip of water and then you swallow it. Yes, so that is the third point. Intake liquids in between feeds. It doesn't have to be water. If you're eating idli, the liquid can be sambar as well. So anything. The next is sip water frequently. Maintain your overall hydration. The next one is chew well. See, before a piece of banana, you just chew twice and then you swallow because you're having good lubrication. So you twice one piece of banana chewing only twice like this is enough. But now that is not going to be enough. I want you to break down the food into minute particles so that it would be helpful in pushing the food, and also if you're taking a sip of water, and also to make a bolus. So I want you to chew well. Don't chew haphazardly. No one chew, two chew. Chew really well. Make sure the food is broken down into smaller particles. And next one is not a no-brainer. This avoid excessive oily and spicy food because of the absence of saliva. You'll have difficulties. And then the last thing is be mindful of your eating. When you're eating, it is not like before. You can eat and watch TV and everything because you have to be really mindful of your eating. You know when you need water. So when you chew, think about the food that you're eating, think about what you need. And when you need, you don't have to drink water every now and then. You know when you need water. So be mindful of your eating. So with respect to oral phase, there is nothing. However, with respect to your throat phase, food is sticking here. Food is sticking here. Food is not going here somewhere. What can I do? I'm going to teach you 3 different exercises or 3 different maneuvers you can call. These are not exercises, maneuvers. And that first one is closing our windpipe strategy. So as I said that windpipe closing is really important. You cannot be always sure that your windpipe is always closing, especially people who are experiencing Sjogrens. As years goes by, there is possibility because of your own body attacking, your own antigen attacking your own body. There are possibilities it will start attacking your esophagus also. So what do? You have to start closing your windpipe. And how do I going to do? How am I going to do that? Is so now, as I have pointed out here, this is your windpipe, which is very big, and food pipe is very small. So while you're eating, do not eat like this. So while you're looking up, what are you doing? Already the food pipe is very small. If you're looking up, you're making it even smaller and you're widening this. So the best thing here to do on how to effectively close your windpipe is to look down. Put your chin in your breastplate. This is your breastplate. So put your chin in your breastplate like this. So when you do that, you are minimizing your windpipe. See, this is my windpipe. If I do this, I'm constricting my food pipe, but I'm eating. I'm not going to do that. I'm going to constrict my windpipe. So like this. So I'm not, and now I'm expanding here. I have expanded here by looking down. And how I'm looking down, putting my chin on my breastplate like this, and then eating. So I have a bottle of water. People think that, oh, it is not possible. It is very difficult. Trust me, this is the most easiest way that you can do. So I have a bottle of water. I'm going to take a sip of water. You can take a sip of water however you want. You can also take a sip of water like this. But this is to swallow. While swallowing, be careful. This is how you have to do this. Again, this may not be completely helpful to you or might not be completely needed for you at this moment. But I'm pretty sure that you would use this when you're having difficulty, say for an example, eating your morning pills or eating your medication, eating something that is very hard to swallow. Or even you can tell these same exercises to your any elderly in your house. Any elderly people in your house will also have swallowing difficulties. They will say, oh, nowadays I cannot eat hard food. I can only eat soft food, old people. You can also tell these to them because these problem, anyone who is having difficulty in swallowing will benefit from this simple solution by looking down. You can drink however, you can take in the food however, but while swallowing, look down and swallow because you're using your windpipe. Once again, like this. Very simple. All right. Now on to the second one. Okay, I do all that. It is fine. But I want to strengthen my muscle. This is the real exercise. How do I strengthen my muscle? So I have my towel here. I've bought my towel. So I'm going to just roll this towel into like this. I've just rolled my towel here and I'm going to put it under my throat. I'm going to hold it here. So the exercise here is to strengthen my throat muscle. If you feel that your food is sticking here, if you feel that your food is sticking here or here, anywhere, you can follow this exercise. So what do you do here? You take a towel, roll it, put it in your throat, and that now you have to press it like this. Hold it for 30 seconds. So I am holding it with my hands now, putting it, I'm going to press it, taking my hands away. So I'm going to keep on pressing it for 30 seconds. I'll just do it for 10 seconds here. So this is the first one. So if you do this, the pressure that is created, it will push your throat like this. You will not feel it very much, but a very effective therapy technique to strengthen your throat muscle. So what will happen when you push? See, this is my throat muscle. I hope everyone can see. I'll come little closer. Okay. So this is my throat muscle. I hope everyone can see. This is my throat muscle. What will happen is, so if I do this, what will happen? People can ask, this doesn't look like one exercise. Well, I'll just tell you. So this is my throat muscle here. When you press here, see, this will come up. So this small movement here, I hope you all can see.
Yes, we can.
So this movement is what is required to help you swallow better, because this is the important muscle here that is a deciding factor of whether the food is going to your food pipe or the food will enter to your windpipe. This is at this point, the point where your face finish, throat begins, this the connecting point. This is where my face is finishing, my throat is beginning. This connecting point is really important. It will be really hard if you touch also. This connecting point is what makes a lot different. So this exercise will strengthen this. So if I do this without the towel, it will look like this. If I'm pressing onto the towel, this, say I'm pushing it. This is the exercise. So with the towel, it will look like this, something like this. So towel, take the towel, put it here, and then press it for 30 seconds. That is step one. Then take the towel, put it here, and then press it for 30 times like this. 1, 2. It's just not keep your, it is not keep your face down and leave. No, not this. This is what, nothing doing. What is this? This is no. Press really hard. That is the exercise. There should be some kind of discomfort. If an exercise doesn't have a discomfort, then it is not an exercise. Exercise should have some discomfort. If it is very easy, you don't feel anything, then it is not one exercise. It is just not put your face down, take it out. Not like this. It's very nothing is happening here. Lot of space. Press really hard. Press hard for 30 seconds. That's the first one. Next one is press really hard and then take it away. 1, 2, 3, 4. So you have to press really hard. So this has to sit between your breastplate and your jaw. So if you cannot find a towel with this big, take a blanket, roll that blanket, because blankets are big. You should not hold it actually. Essentially, when you're doing the exercise, you should not hold it with your hands. It should be that big. Something like this. So when we do this point here, as I said, what is important is where your throat, face ends and throat begins. This point, the above, little bit above Adam's apple. We also have Adam's apple. Everyone have Adam's apple, but for us it is not prominent. So little bit above the Adam's apple is what the deciding factor is, and that is where we are strengthening it. And then the last and final is the hand clench, push your food effectively. Hand clench exercise. This is only a maneuver, is not one exercise. So what do you do when you feel the food is stuck here? Take your hands, clench your hands as tight as you can, and then you swallow the food. See, when I'm swallowing, hope you can, again, I'll take this as ma'am said, you can see my muscles here. So I'm taking my hands, clenching my hands. Then when I feel that, food is stuck somewhere here, clench, swallow, swallow. I hope you all can see my muscles here that is popping out. So this is what is important. This is the effective method. Always clench your hand as tight as you can. Clench your whole body, tighten your whole body, and do this. So when you feel that always you feel that food is getting stuck, it is not going, do this hand clench five times, and even separately, and also during swallowing. So close your windpipe is look down and eating. You can follow this when you feel that you're always choking, or the food is entering your windpipe. This is the most safest one. You can also recommend this exercises to each anyone, because it's the best way that you can do. Next is strengthening your throat muscle is with a towel. And third is pushing the food effectively. That is the hand clench method. Just one more realistic image where I wanted to focus on how small the food pipe is. The food pipe is actually, this is the original representation. If you see, it is very, very small. It will only open up during swallowing. Otherwise, since we need, breathing is important for mankind, what God has given is more of windpipe space and very little of food pipe space. And food pipe space will only expand when the food is coming. So it's a very brilliant mechanism, but it can also hamper us when this lid, epiglottis, is not closing properly. Then it is all very, very difficult because it's much bigger. So the exercise regime, closing of the windpipe always and every time while eating is recommended. It's not, it's the best way. Anyone can follow this. People with Sjogren's, without Sjogren's, or old people, or people with stroke patients. Anyone can always follow this. Looking down is the best way. The towel exercise, the 30 seconds hold for 3 times, and 30 times again for 3 times, and do it for twice a day. The hand clench exercises I have put as during every difficult swallow, but you can also do it without swallowing. Just take a sip of water. Even if you do not have anything, just take as a practice. You can just take a sip of water like this. And then swallow very tightly. That is all.
Sahana, how do we do this closing of windpipe? Just by not talking or something else?
You put your chin
to
your breastplate.
Okay.
And then you swallow. Because see, imagine this is the pipe. It's here like this. So if I do this, it's getting closed, right? If it is like this, if I do this, see, it's closed. Like that.
Okay. Thank you.
So in conclusion, you have to be mindful of your dental health, because there is no running away from this. People of Sjogren syndrome, including my mom who is sitting right here, have to experience this. There is nothing we can do. Try to cut down unnecessary dry foods, not meaning dry fruits, but dry foods. You can take it, but when you're taking it, make sure to take a sip of water. Keep a track of your hydration. The next thing is oil pulling twice a day, morning and also before going to bed, will be extremely helpful. Next is brushing, and also investing in a good electric brush will be helpful, because dental cavities and fungal growth and enamel problem are major problem in people with Sjogren's. So if you can invest in a good electric toothbrush, then it will be good. And as I said, be mindful of your eating, because only you know when you need water, when you need to do tight swallow, when you need to swallow happily. So please be mindful. And then now next point is, we cannot run away from dysphagia because it is a part of the dryness of the eyes, dryness of our mouth, and dryness of the vaginal. This one is the definition of the Sjogren's. So we cannot run away from that. And dysphagia is not curable, but it is manageable. And so let us embrace it rather than fighting it.